You got to go talk to your healthcare professional and get your physicals done. Fellas, don't get scared. You got to do it. That's what we're talking about today. Men's health. And without further ado, I would like to introduce to you our certified registered nurse, Dr. Mo. Welcome to the Dub and Trey Show.
Well, hello, fellas. I am excited to finally get a chance to have a conversation with you all on the Dub and Trey Super Podcast. I'm so proud of the work that you all do day in, day out, all of the topics that you all have explored. And June is Men's Health Month. And so I'm excited that we're able to have this conversation, a candid conversation, a vulnerable set of conversation topics, and an important set of conversations to have for your listeners and for your female listeners, for them to impress upon the men in their life to address if you love your man, make sure he's taking care of himself. So let's do it.
Yeah, that's a good point. I mean, a lot of times you hear a lot of different arguments going on in relationships and in the dating world, but you never hear anything about health. There's so many things that are trending in society and what we got going on, but you never truly hear or hear the push about, health, and particularly men's health. So I definitely thank you for coming on to the show and definitely shedding some insight on some questions that we may have. And we want people out there to also chime in as well if they have questions that we can relay to Dr. Mo. So without further ado, let's get right to it. So I'm gonna dive deep in first and foremost,
Well, before you dive deep into your set of questions and things, I do want to offer a disclaimer for your listeners. Okay.
Okay.
So we are not taking the place of your healthcare professionals. I am a registered nurse. I've been a registered nurse for the last 24 years. I am very excited about the care that I have provided in the community, and I got a master's degree in nursing education, and I also have a doctoral PhD in nursing education. So as important that it is for nurses to provide patient care, it's also important for us to educate our community, and our community is especially vulnerable when it comes to just health awareness and health education, health literacy, and all those pieces. So whenever we get a chance to have a platform similar to yours, we definitely want to tap into the community, because we may be able to just change one person's life, have one person that can go and get the help that they need, and that one person can change their whole family. So I'm excited to be on here, but please know we're not taking the place of your healthcare professional. You do need to still schedule an appointment, have those conversations, be vulnerable and honest and transparent with your healthcare professional, because they really want to be there to help you. If you leave stuff out and all that kind of stuff, you may not get the full care that you need. And just don't take our word for it. We're going to talk about some things as a generality, or things that are an overview just for men. But based on your family history, based on your other health challenges that you may be experiencing, your doctor or your nurse practitioner may want to approach your health in a different way. So we're going to give you some good information to maybe ask some questions with your healthcare professional, but don't let this conversation take the place of you going in and getting the care that you need.
Yeah, you know what I'm gonna say before you hit that question, Trey, right where you started at, Doc. I'm gonna call you Doc.
That'll work.
Get a primary healthcare physician, fellas. The person that she's telling you need to be talking to, get one of those. If you don't have a primary healthcare physician, you need to get one. Urgent care is not a primary healthcare physician replacement. So if you do not have a doctor or primary doctor, you need to get one to have these conversations that the doc is telling you about. So that's all I wanted to say, since she kind of touched on that one already.
Absolutely. And a shameless plug for all the nurse practitioners out there. because we got male and female physicians, we got male and female nurse practitioners. So if you want a lady taking care of you, that'll work. If you just want another fella to talk to about things, they have what you need out there. So, and again, you're absolutely right. Urgent care, they will tell you to follow up after you've gone to urgent care with your primary care doctor. So make that happen.
Great information. I'll keep it right there. I was going to go a different direction, but since we're talking about it, why do you think, and I'll pose this question to you, Dr. Mo and Doug, why do you think men don't practice this? Why is it so hard for men to communicate that they have these issues? Why are there so many men that don't have not only an actual doctor, but health insurance? But yet we know an uncle, we know a cousin, we know a brother, we know a father that are gone too soon. So I just wanted you guys to briefly touch on that, and my opinion would be that we feel like there's not a safe space for us to communicate, and whether it be in a relationship or how we were actually raised. Mm-hmm. I don't recall myself having stressful, or not stressful, but intentful conversations about my health until I got older. But it wasn't something that was really stressed to me at a very young age. And it may have been because I was healthy. But what do you guys think about that?
You can go ahead, Doc.
Okay.
Cool.
I want to hear opinions first, then I'm going to tell you about some facts I know.
Okay. Well, I'll go. I'll let you know what I think then. So I think, for one thing, I think some men have a badge of honor that we tend to wear, that we, even though we may know we suffer with health ailments and things like that, we feel like we can handle it. Mm-hmm. And that's what we do, right? It's a fear of judgment, where some men feel like that if there's certain things that's going on that either makes them less of a man or less masculine or things like that. I think there's fear where some people choose to remain ignorant. Mm-hmm. Like, if I don't know, it's better. I'll just figure it out if it happens. But as long as I don't know and I don't have any physical like symptoms of something,
right, I
don't care. And then I also think that it kind of leans into sort of the way people handle money, where they don't think about tomorrow. Mm-hmm. They don't think about prevention versus resolution when they cross that bridge. It's like, oh, I'll worry about that when it comes.
More reaction versus proactive.
Yeah, exactly. Mm-hmm. Thinking about their life, and I think that's just the way a person would think, not necessarily about health, but just in general about their life. If you always think, I'll worry about it when it happens, mm-hmm. then when it comes to health, you're not going to go get your checkups. You're not going to go do preventative things, mm-hmm. To keep you out of the doctor, out of the hospital, mm-hmm. Once something comes about. So those are a few reasons why I think men have issues doing that preventative piece and having these conversations and going to see doctors.
So you hit the nail right on the head. The first piece of it is absolutely fear. Many times, just not even 2 or 3 generations behind us, our family members would go into the hospital and not come back home because they went to the hospital late. They had a poor diagnosis. They had a poor outcome. And so then it was fear. I don't want to go to the doctor. Whenever you go to that hospital, people don't come out alive, or that type of a thing. Right. And then there's this distrust with the medical profession. So if you think back to the Tuskegee experiment, where they told the men that they were treating them and they were not treating them. And so we do have federal laws and things to go into place with the research that's happening to make sure that people are well informed, so that the distrust that happened then would not continue on. And so the big piece with distrust is huge. Once you violated that trust, it's really hard to get someone to come in and say, okay, this health insurance company is going to provide me health insurance, but can I trust them that they're going to give me the care that I need? Well, this doctor is getting information from a pharmaceutical company. Is this medication really something that's going to help me, or are you trying to put money in your pocket? So all of those pieces with the distrust is really hard to overcome, especially if you're not focused in on looking at healthcare from a larger lens beyond just pharmaceuticals. If you're doing homeopathic or you're doing naturalist type of things, those things don't have any real monetary return on the provider that's giving you that information, but it may be very helpful for your care. So as we're looking at the fear, we're looking at distrust, we're looking at health literacy. And I don't mean ignorance in a negative way. I mean it in the truest sense of the word. We can research and find out how we want to do our parlays, but we're not researching and figuring out what do I need to do to make sure I'm not underinsured, or that the money that's coming out of my check is really going to the right things. Do I have dental care? Do I have vision care? Do I have health care? Is it enough to really meet the needs that I have? And then do I need a flex spending plan? Because there are things that your insurance is going to cover, but then there are things that it's not. So do you need a copay money and all of those things? So when you talk about the finance piece of it, that's a huge piece of the puzzle. Can I afford a day to go to work? If someone is an hourly employee, that's really going to be a hardship for them. How am I going to go to the doctor? And you all know, you go to the doctor, you get there, you might not be seen right at your time. So you have to be patient. And because when you go back there with the provider, you want the provider to give you that same amount of attention and care. So, fear, finances, distrust, the really lack of understanding what the healthcare system is all about. We're in the United States. This is what we have. We're not in a country that just gives us free, open healthcare insurance. So we have to be very smart consumers of that insurance. So those are the big pieces as to why men are a little hesitant to get the care, and especially if you've not seen it in your family line, where your family is not openly talking about the health challenges. Oh, grandpa just passed. Well, why did grandpa pass? Right. Oh, I don't know. Grandpa he was old. Well, no.
Right. Nobody wants to talk about it.
They don't want to talk about it. Some things just have to stay within the family. And that really does not help us if we're trying to look at things that may be genetic markers. So if you have a history of a certain disease stat in your family, it'd be helpful to know that so that you can be proactive, as Trey was saying, versus being reactive. And then, oh, wow, I have this diagnosis. Could we have caught it earlier? So those are some of the reasons why, people are just either underinsured, not getting the care they need, and all of those things. Yeah.
I agree. I definitely think we need to make more of an effort to overcome those cultural stigmas, and understanding that it's okay to be vulnerable. It's okay to feel confused. It's okay to be afraid, because you don't know what a colonoscopy is. You don't know what that consists of. You don't know how to feel when you're getting ready to get a prostate check. It's a normal thing. It's okay for you to have these confused, afraid feelings. And I think that's something that really needs to be honed in on for a lot of men, because I think that a lot of us just avoid it because we think there's a type of cliche negative part that comes along with it, or just being afraid of the unknown. You may know that your family has prostate cancer, genetics, a lot of these things, and Doctor, I'll let you get into a lot of those things, but being okay with the unknown and being okay with being vulnerable and doing yourself that due diligence to find out what's going on with your body. We have to bring light to that. That's just a critical piece.
Yeah.
The only thing I'll add to that is fellas, you don't have to wait till you feel something before you go see a doctor. You can go get a wellness check and get tests and things done before you have any symptoms of something. So you don't have to wait until you don't feel okay, to go see a doctor for whatever reason you may need to see one. So I think that's the one as well.
Yep, I think it's a special birthday gift for myself, and I encourage everyone around me to treat yourself for your birthday. I don't believe you should work on your birthday. That's just one of my things. And then within that birthday week, you should go and get checked out by a healthcare professional. So for the ladies out there, we're getting pap smears, we're getting mammograms, we're doing all of those things that we need to do for that preventative care. And the women have their struggles. They have the things that they have going on and the kids and all of those pieces. But our men, you all have such a heavy lift by protecting and providing for the entire family unit, not just necessarily your wife or your children, but you have your extended family. And some of our men, they're like the Mufasa of their family. They're the only man that's leading in that space. There's a tribe full of women, and you got one or two men that are there as the voice or spokesperson for the family. So the weight that they're carrying and that level of stress that they're carrying, and worrying about how the kids are doing, how I'm doing, how my lady's doing, how's my mama doing. You have all of these things that you are putting on, and then it's like, okay, when we all get on flights, they tell us, put our mask on first and then help somebody else. And so our men have to take that lesson to heart. We need you all. If you're protecting and providing us, we need you to be at your healthiest peak and to get the information that you need about your health. Be proactive with it. And you really want to be proactive, because the earlier you find out about something, the easier it is to treat it. So, and just like you're saying, Dub, if you have an annual wellness checkup, let that be your birthday gift to yourself. You're going to buy yourself some sneakers, or you're going to get yourself some nice cologne, or you might go out and have a cigar and a drink, or something to celebrate your birthday. Thank you. I got a whole another year around, or I got another cycle, or however you describe your, time around the earth. Take that time just to make sure that you are not just outside looking nice for your birthday. You got your hair cut, you got your shape up, you smelling good, you looking good, but on the inside, your body is all messed up. So treat yourself to that birthday visit to the doctor.
And I could definitely say that when I go to the doctor, I'll speak for myself, and I know I have a clean bill of health, it definitely makes me feel just good and positive, like the energy you get knowing that you're okay. You don't have to guess, just, and that's an awesome idea to do that for your birthday, to know that you're in good health, because it's a great feeling to know that you are.
Yeah. Make it a way of life. Make it part of your life. Just like going out, just like working out, just like checking in with the kids, going to work, you have to make it a part of your life.
And if you are afraid about going, don't go alone. There's someone that you trust. There's someone that you love, whether it's your mother, whether it's your lady. If you're not sure about that, you got a dude that's your ride or die. Hey, man, I need a companion. I need somebody to go, because sometimes they talk about things in these appointments and they're talking fast. You may not fully understand what they're saying. So even just to have a buddy with you, if the two of you could hear half of what they're saying, you're both leaving out with more information than if you went by yourself.
Right.
So,
Absolutely.
So it's so important. You don't have to do this life journey by yourself. And, I know dudes, I'm a dude, I'm strong, I'm a man, I got this. And you do. We know you do. But it's nothing wrong with having a buddy, having a guy on the side, having a friend that you can trust that can go in with you. Even if they just waiting in the waiting room, they don't have to go back in the doctor's office with you, just to know that somebody is there supporting you and caring for you. And then when the shoe is on the other foot, fellas, do the same thing. Be there for your lady, be there for you. You're going to take your kids to the doctor. Take yourself to the doctor too.
Yeah.
And you owe that to your children as well. I mean, we need you here. The kids need you there for a long, long, long time. So, you just taking the kids to the doctor getting checkups and you're not doing them yourself, you're actually defeating the purpose of what you should be doing for your child and for yourself, because your child wants you there, not just while they're young. They need you there for a very long time. So definitely get checked out, fellas.
Yeah. Like an infant needs you to feed them and change them and love on them and burp them a little bit. But them teenagers and the adolescents and the young adults,
they might put you in the hospital.
Oh my gosh.
They might put you in the hospital, but while you're there, while your child is giving you, heart pain, go ahead and get your blood work done.
Get your blood work done. Yes, indeed. Yes, indeed.
Yeah. Prostate cancer.
Prostate cancer, yes. So, so for our young boys, I just wanted to touch just a little bit on testicular cancer. And so we want to make sure that we're having conversations with our young princes, our fellas that are princes, not the princess girls, our fellas that are princes, our young kings. Mm-hmm. We want to start having conversations with them early about their body and their body changes and things like that. So our young kings are at risk for testicular cancer. So we want to make sure that they know where their testicles are, what they're like, what they're there for, and if there's any bumps or anything that's on them. There shouldn't be, but if there's any changes, they need to let their parents know and then talk with their provider. For our older gentlemen, depending upon your family history, depending upon your age, you want to make sure you're getting your prostate checked. There's 2 ways to get that prostate checked. The first way is a digital rectal exam. Most of my fellas don't even want to have that conversation. I'm not gay. I'm not homosexual. I don't want nobody putting their finger in my behind, all of that. And I'm like, fellas, calm down.
That was the only way at one point.
That was the only way at one point. And grandpa and great grandpa was like, not having it. It's not getting done.
Right.
And so, they were unaware, and many of them had poor health outcomes because of a quick exam that could have saved their lives, and they would not have had the outcomes that they had. So yes, it is a quick moment in time. It is what it is. We all have to go through different struggles. I know when y'all at the barbershop and the barber nick your face or nick your hairline, you're not happy, but you keep going back to the barber. You go to the dentist, you get a root canal, you get your teeth done. You're not happy about it, but you go back. For us to have a digital rectal exam, it's actually not as painful as getting nicked at the barber. But people don't want to do it just because of the stigma that goes along with it. So, you have a good healthcare professional. They'll talk you through it. It's a quick process. Keep it moving. Now we also have modern technology where they can draw your blood and you can get a prostate surface antigen test. And depending upon your age and your family history, your doctor or nurse practitioner will tell you what range they want you to be in. And then they're going to continue to monitor it. So some people have to get it monitored every 6 months. Some people get it monitored every year. But at the end of the day, we want to know, is your prostate enlarged? Are you having a hard time urinating? Is it causing you pain, discomfort? We don't want to wait till it's there. We want to address things early. So, between the digital rectal exam and getting your prostate surface antigen test done, we just want you all to be aware of what's going on with your body on the inside. It's not as easy to see these things like we can see your eyebrows or your eyelashes or your earrings in your ear. These things we got to go inside to take a look at. But it's so important because if you don't have to go down that road, and for my fellas, if you think it's very invasive to have the digital rectal exam, just think about having to have surgery on that prostate and then have to recover and go through all of the care that you need in that most private area because you got some information late. Go get the information early and try to, prevent some things ahead of time. That's the PSA. That's all about our prostate.
A PSA, baby.
Yeah.
And we're talking about a small amount of discomfort for saving your life.
Absolutely.
And if, for me, if your fear of assuming that makes you homosexual or your misconceptions of sexuality built around your health and your life, you need to read, you need to educate yourself.
That's right.
Because you should not be assuming those two things have anything to do with each other.
Exactly.
Because they don't. And it is discomfort. It's not comfortable. Like something Trey touched on, you could be a little scared of it. But what we're talking about is your children, your loved ones, your fellas, your parents, whomever love you, you love yourself. You're talking about a small amount of discomfort that addresses the rest of your life.
That's it. That's it. We put ourselves through more uncomfortable things than that. Day in, day out.
Yeah.
And keep it moving like it's nothing.
I think it's you owe it. You cannot say you're a responsible person if you're not doing these things when it comes to your own body. And, having your priorities straight just doesn't mean you are taking care of the kids and taking care of your finances. You need to be taking care of your health as well. And if that's not in order, then you got work to do. And again, nothing's perfect. We all have work to do. I've had my PSA checked and my prostate checked, and I'm going to continue to get it checked. So, you owe it to yourself, fellas. You owe it to yourself to, first and foremost, you owe it to yourself to get your PSA blood work done and get your prostate checked. Do whatever it is you need to do to find out what's going on with your body.
That's it.
And if your dude run around with tattoos, you already been through temporary discomfort that didn't last that long.
Absolutely.
That's on you for the rest of your life.
Yeah,
that's a great point, Deb. Absolutely.
So everybody running around with tattoos all over the place. You already doing it.
Exactly.
And tattoos don't save your life.
That's right.
They don't. Yeah. That's a great example. Perfect.
So I also want to touch on some of the things that, things are done in moderation. We're not telling anybody that. This is just my opinion. We're not telling anybody they can't have fun. You can't have a cigar or have a drink, but you need to understand that things need to be done in moderation, if at all. And you also need to understand that if you're abusing something, you definitely need to go right away. So if you can hear us right now and you have not got yourself checked out, fellas, men, go get yourself checked out, man. I'm go push this as much as I can. So definitely, do that.
Yes, please get yourself checked, and and your physician, your nurse practitioner can check you out for sexually transmitted infections and any other things that are going on with your genital health. Is so very important.
Right into the freaky stuff, didn't she?
No, but I didn't mean to. I just, but your prostate is important for you to have performance with your ladies. So
super
you
important.
got to make sure that prostate is all right. So
you got to. You're right.
you have to. You want your lady smiling and to be taken care of. So she should be advocating for you to get that PSA checked.
And your diet. I mean, and at things we eat now, at this point, you don't need to have sex with anybody. If you eat too much steak, you can have an enlarged prostate. If you eat anything that's not good for you for a long period of time, it could affect your prostate.
It can.
Yeah.
So, be mindful of that. Be mindful. And the information is out there. I mean, research. There are books that you can, how to cook things a better way. And like I said, I'm learning as I go, but you definitely want to make sure that you get better. Like I said, I just want my men to get better.
Yeah. And just so you know, just from your anatomical structures, your prostate, your bladder is here, and then no one can see me. So your bladder is there, and then you have your urethra where your urine comes out. But your prostate, if it's enlarged, can impress upon your urethra, so that can cause discomfort when you're trying to urinate. So you want to make sure that you're staying well hydrated, that you're thinking about, if you want to have some libations, do your thing, but just make sure you're hydrating, taking good care of your body, and doing things in moderation and having balance is so very important. So take good care of your bodies.
Yeah.
For sure.
We talking about colonoscopy now.
Colonoscopy, you already know.
Okay,
Let's go.
let's do it. Let's do it. Still talking about,
We going in the same way. Let's
we're
go.
going in the
Going in the
exact
same
same
way.
way. But the good news with the colonoscopy, after you've taken all of the beverages that you needed to cleanse out your colon, they do put you to sleep for this procedure. So you take a little nap and wake up and it'll be over. So basically with the colonoscopy, the hardest part is just not eating as you're preparing for the procedure. And so
That's not the hardest part. That's not the hardest.
that's not the hardest part.
The hardest part is drinking that whatever it is
Oh
that
yeah,
you gotta
that was
drink.
next. That the go lightly or the beverage that you gotta
Man.
drink to get it all in and get it all out.
Woo.
Well, I'm
Fellas,
glad that you can
hold
explain
tight.
what's going on because that means you've had it done. So
Oh yeah, absolutely.
you get a not a I voted sticker like when we go vote, but we want you to have that good
Yeah, fellas,
sticker
we're gonna
that
get
got it done.
I had a colonoscopy
We
sticker.
need to get a
There
sticker
you
made.
go. Need a sticker. There we go.
I'm gonna get my sticker in 2 months. So
Yeah,
Okay,
man.
not a Mr. Yuck sticker now. Going way
That's
back
right.
with Mr. Yuck, but the beverage that you have to drink, it's pretty nasty. It is a lot you have
It's
to
tough.
drink.
It's tough.
And
It cleans you out though.
it definitely does.
If you try and lose a couple pounds, you gonna do it.
Yeah.
So
Go ahead. I was gonna say, can you explain to some of the listeners who don't understand the point and
yes.
the purpose of that procedure?
Absolutely.
You know?
So within our colon, we have our stomach and then our intestines. And so as we're digesting our food and then we're eliminating it out, we want to make sure that that passageway is nice and clean. And so sometimes you can develop polyps, which would be like speed bumps, if you will, in your intestinal tract. And so as you are trying to excrete stool from your rectum, there may be challenges along the way. So you may have constipation, or you may have diarrhea, or you may have abdominal pain, abdominal cramping. And so if you have polyps that build up, it just creates barriers to that flow going out well. Polyps can be benign, which means that they are non-cancerous, or you can have growths that could be some form of a tumor. Some tumors can have cancer cells in them and some of them cannot. So the whole point of us is just making sure that what we take in goes out without any trouble. And so if there are, again, barriers to the stool being excreted, we want to go in and be able to see firsthand. So again, we can look at you on the outside and you look completely healthy. But once you take the Go Lightly or the beverage that helps to clean you out in preparation for the colonoscopy, they then take a camera lens with a long tube. They put you to sleep so you're nice and rested. You don't know what's going on. And they advance that tube into your rectum and they look up inside of your intestines to see if there are polyps, tumors, if there's anything that should not be there. And again, why is that important? If you cannot eliminate stool, what is going to happen with the backup? Is it going to get stuck in your stomach? Are you going to be able to eat? Do you need to have a tube or an opening on your belly so that your stool can come out that way? So we want to get you in to get a colonoscopy because if there's any obstruction or any problem with your colon, we have to fix that because what goes in has to come out. Wow. And so if it does not come out of your natural anus opening, then does the doctor have to put an opening on either side of your belly button, your umbilicus? And so if you have to get a colostomy bag and have to eliminate stool that way because you've had a blockage, because you've had cancer, just imagine how much work is going to be to take care of that portion of your body when you could have been proactive and gotten a colonoscopy. They could have looked up there, and if you got a couple of polyps, they can cut those out. They'll send them to the lab to see if they're normal cells, if they're benign, no cancer cells, or if there are cancer cells. So it's best to get that information early, because even if you have polyps, they can get them out. No harm, no foul. And if you do have family history of colon cancer, they may want to check you earlier than, 45, 50 years old. But it's so important, because if we wait until too late and then you have obstructions, then we're going to have a surgical route, which is not what any of us want. So we want to be proactive in getting that done. Yeah. And again, you're going to drink that solution. And when you go that morning, they're going to put you on, you get a nice little nap. You will have some really nice, relaxing drugs for you to have the procedure done. And so you don't even have to worry about the pain or discomfort of them advancing that scope into your bottom.
You won't feel a thing.
You won't feel
fellas. You're not gay when you sleep, fellas, so you'll be asleep for this one, okay?
You're going to wake up real gassy, like, and you won't be able to drive. So make sure you have somebody drive you and pick you up.
Great information.
So ladies, make sure you tell your man, your husband, your boyfriend, your ride or die, tell them that Dub and Trey said, go get that colonoscopy. Stop being afraid and scared. Go get that colonoscopy.
There you go. Get it. Let's do it. Like I said, and that one you will need a companion to go with you, because again, you won't be able to drive home, because they're gonna make you feel nice. You're gonna have some nice little put you to sleep drugs, and then you'll wake on up and you'll be ready to go home and just rest. And then after you have your colonoscopy, it is not the time to go get crab legs and steak dinners. You're going to have to slowly get your diet back, because remember, you didn't eat much and you didn't drink everything to get it all out. So you might have some applesauce or some Jell-O, and then slowly get some soup and all of that. But we're not going to Ruth Chris next.
Right. And to touch, Dr. Moore, definitely want you to touch on this kind of the same thing that I talked about briefly for prostate cancer. When it comes to, moderation, those polyps, it could be, genetic, it could be anything, but alcohol use and tobacco use, again, is another thing that we need to highlight, because, this is our culture. This is what we do in a lot of communities. So just be mindful that, if you are living that lifestyle with no checks and balances, something is going to happen.
And just, we're in a culture right now where everybody's talking about toxic people, and we're not really having much conversation about the toxic things that we put into our body. And, we all want a libation here and there. We want to have our, all the things that we enjoy. We want to enjoy those things, but we do have to think about the impact that it has on our body. So are we doing some detoxing? Are we hydrating? Are we exercising? Are we using the saunas and the technologies and resources and things that are out there? Just as we're going to, like I said, I know many of us pay close attention to our external. We're going to get massages. We're going to get facials. We're going to make sure that we have the best creams and lotions for our skin. But are we doing the things that we need to do for the insides of our body? So, so take that time, if you're doing your vitamins, and some people are doing the sea moss, and, so many health remedies out there that people are trying, and, oh no, I swear by medical marijuana, do your thing. But just know, whatever you put in your body can turn into a toxin once it's inside, and you want to make sure that you're hydrating, detoxing, and taking good care of the inside, not just the outside of our bodies.
Yeah, and I would before you go, I would also say, another thing that just came to mind: be honest with your health. And I thought about that statement. I just think about, we're so tied up with integrity and honor and a lot of different things, and how we want to be treated, and how we thrive to treat people. But you could really be in denial with your own health, and you're actually lying to yourself. So be honest with your health, be honest with the state that you're in, and like Dub said, be proactive about it. Don't be reactive. And again, your body does talk to you. Pay attention to those signs, and don't just ignore just don't ignore those small signs that your body will give you if you having trouble walking up steps, or if you have a sharp pain in your chest. Something doesn't feel like it's normal. You definitely want to get seen right away. So
Absolutely.
Yeah. So what I was going to touch on is something you just talked about the about the multivitamins and the all the kind of health things that people are starting to take, right? And we all assume that these things are healthy for us to take. And I'm assuming, you obviously I want your opinion on this. Should we be having these conversations with our primary care physicians about saying, hey, I'm thinking about taking this product. Are there any concerns that you have with me taking this from you knowing my health experiences, right? Because now it's stuff about mushrooms and lion mane. And I mean, it's just, I don't know. I feel like it's all going crazy with the stuff people are telling you should take, and it does this and it does that for, cognitive health and this and that. And there's so much. And honestly, I sit back and I go, how do I know that is actually going to do for me what it's what it's saying it's doing, just because some random dude on Facebook or IG or something is saying, hey, this is the greatest thing. It changed my life. You don't know this dude from nowhere.
Yep. I need that alkaline water, and I need, all of these things. And so the answer to that question is absolutely yes. So it is very important to have an honest conversation when you first go in on your annual physical. One of the first things the doctor or nurse practitioner is going to do in their assessment of you is ask you a bunch of subjective questions. So what's your family history? What's your social history? Do you smoke? Do you drink? If you smoke, is it cigarettes? Is it tobacco? Is it Black and Milds? Or, is it cigars? Is it marijuana? Whatever, all of those social history pieces. But then they're going to ask you, are you taking any medications that are prescribed? And so whatever you may be on, that's a prescription from a physician or healthcare professional. It is very important to talk about the supplements that you are taking, because those supplements may counteract some of the medications that you're prescribed for. So if you're on something, say you have a blood clotting disorder and they have you on something that's thinning your blood. Well, now you're taking this multivitamin that has something in it, but it's deactivating what's happening with the medication that you have prescribed. And you're trying to figure out, man, I'm taking this medicine, but I keep having these clots. Well, did you have that conversation with your healthcare professional? It's important for them to know everything that you are putting in your body. Because again, like I said, just when you put it in, it could possibly turn into a toxin and you not even know it. So whether it's the CMOS, whether it's a multivitamin, and if you read the labels on the supplements, they will tell you these are not regulated. Not by the Food and Drug Administration, through Department of Agriculture, not through there's typically not anyone who has oversight of the supplement world. So you really, truly may not know what's in those products. So I know a lot of us may have issues with the pharmaceutical companies, but at least we know that they have trials, they have studies and research and things that they have to supply and show, proven what's been going on with that medication. But that's not the same way that those supplements are regulated. So it's so important for you to know what you're putting in your body.
That's a great point. Great point.
Yeah, because I thought about that, because like we take a lot of things. Even I do. I have at one point, taking certain multivitamins and protein and things that are supposed to, do certain things for recovery when I work out and things like that, right? But not really understanding that these are conversations I should have been having with my primary care physician. Say, hey, I'm taking these things together, even though the people who are selling them are telling me, oh, no, you can stack these. That's what they call it, stack, right? You can stack all these products together and you should be fine. But none of these people are doctors.
None of them are doctors, and they don't know your body.
Body type.
What state is your kidney, are your kidneys in? What state
Right.
is your liver in? So
Right.
if you think about how your body works, when you put stuff into your body, it either is going to be eliminated through your stool or eliminated through your urine. So that means that your stomach, your liver, your kidneys, and your small intestines, colon, all have to maneuver these things you're putting in your body to get out, to keep what you need, and then get out the waste.
Right.
And so, if your kidneys aren't working well, if your liver's not working well, if your colon has some backups, then you're not going to be able to get the nutrients in that you need and eliminate the waste that you want.
Yeah.
That you don't need. And then as that waste builds up in you, that's where those toxins come in. And then you start having those negative health outcomes. So it's so important these supplements may be great, but are they great for you?
Right.
Yeah.
I while you were talking about that, Dub, I thought about when you talked about body type. Everybody's system is different. And how do you identify the type of system you have? And when I say system, I mean your immune system, what you're allergic to. Just because you're not having a reaction to something doesn't necessarily mean that it's not breaking down your immune system. So, anything that you would say to those type of things, doctor, in regards to different tests that we may can take to identify those type of things.
Absolutely. So when you go in for your annual birthday checkup, like we say we all going to do,
Right.
They're going to draw a lot of blood panels to see how things are going. So they'll do a complete blood count. So they'll look at your red blood cells, your white blood cells, all of your immunity with your platelets, how well your blood is clotting and all of those things. And then they'll draw something that's either a comprehensive metabolic panel or a basic metabolic panel. And it's looking at the electrolytes that are in your body. So sodium, potassium, and all of those things. And potassium is so important for our hearts, right? So those numbers those lab results are going to come in and they'll look at those numbers. What's so important for our families that have history of diabetes in it, to get your A1C. So that looks at the red blood cell, and over 90 days, how well has your body been using and fighting off excess glucose, and how your insulin in your body that your pancreas is making, how is it working for you? So we can look at in a comprehensive metabolic panel and look at your glucose number, but looking at your A1C looks at it over time. So depending upon your health situation, your doctor may want that A1C to be less than 6. But if you're pre-diabetic or you have history of diabetes in your family, your doctor may want that number to be a little bit lower. They may want you to eliminate certain things in your diet. They may want to emphasize how important it is for you to exercise and hydrate with water. So again, looking at those numbers, those are things that you should be getting drawn on your annual physical, whether you're male or female. And so looking at just your lab work, and then if you're concerned about allergies and allergens, it's important for you to have allergy tests done. Years past, and some allergy doctors still take a test where they just prick your body all over with all of these allergens. You're walking around like, Edward Scissorhands with all these things on you.
Right.
And so itchy, it's crazy. But now you can do blood work to see what things you're allergic to. And what's fascinating to all of us is that, growing up, you very rarely heard of people with allergies. The emphasis on peanut allergies and things now is just unbelievable. But we were not tested when we were younger. The test was just the little pricks. Now we can draw blood. So we're finding out about more allergens. And I was having a conversation with my cousins this weekend, and it was fascinating how many of us, we were allergic to the same things, never even realized it, never even had a conversation about it. And so then that sparked another conversation about other things that may just be genetically in our family. And so it's important for you to get those allergy tests done. Because you may have food allergies, you may have allergies to chemicals, you may have a insect allergies. A lot of people may be to the bees and things like that. But you may not know that these things are this way because you're putting so much in your body. You don't know what's causing a rash. Is it something you're eating? Is it your lotion? Is it your detergent? It could be so many different things. So it's important to ask those questions. So if your body is responding, have the conversation. That's what we're impressing upon your listeners today. Have the conversation.
Wow, that's great.
Have the conversation.
Something that my doctor, shout out to Dr. Prasad. One thing he tells me is our genetics is the bullet and our lifestyle pulls the trigger.
There you go.
I like
That's a great analogy.
Yeah,
That's perfect.
and he hits me with that all the time.
Yeah.
Just to remind me, like, hey, you know, we're all predisposed to certain things because of our genetic history, our makeup, like what you're touching on. But some of these things we can prevent just by how we're living. You know, our diets, our sleeping, going to the doctor, having these conversations. So, you know, I just always find that profound whenever I think about that statement from him.
Yeah, that's a great analogy. It's very, very prudent.
So, fellas, play this back to the doctor because I know you won't be able to repeat all this great information that we provided.
Right.
Get the test done. Get your allergen test done. Colonoscopy, prostate. Get a sleep test done, fellas. By the way, you need that oxygen going to your brain as well and to your heart. You don't even know. Why are you so tired every day? You may have sleep apnea. So you definitely need to get these tests done. So Deb, you got anything?
We also talk about touching on the you know, the mental and emotional side of health and well-being, and not just the physical piece. You know, from like a holistic view, you know, you gotta approach it from the, you know, the physical, mental, and emotional piece. You know, and something that Dr. Mo touched on earlier in the introduction is just how men struggle with mental health, and seeking help and guidance, and kind of suffering in silence. So, you know, I kind of want to go that route with, you know, and dig into that a little bit.
Sure. So, you know, I think there is a stigma and a taboo about mental health in general. And post-pandemic world, far more people are open to have conversations about mental health awareness. And for many years, it was not a topic that would be approached in many families. It was just like, toughen up, soften up. What's wrong with you? Why do you have these feelings? Man up. Like, and it's just like, well, no, I think asking for help is a sign of strength, and not asking for help is a sign of weakness. So if you think you can do it all by yourself and you think you can, you know, figure it all out on your own, to me, that's a sign of ignorance and weakness. But if you can say, hey, I'm really struggling in this area, I need some help, that means you have great self-awareness and you have found someone that you can trust, that you can be vulnerable with, and then you can get the help that you need. So that takes me to the point. Do men have people that they feel they can be vulnerable with? Some of our men will not be vulnerable with their women in that space because they have had negative experiences with showing their emotional side. So they don't want to show that side because am I going to be seen as less than a man because I'm expressing something that has really I'm struggling with. And, you know, if it's a loss that you're grieving, you all usually will get a pass. But there's a lot of things that we grieve that are not the loss of loved ones. Some of our men lose jobs and they're devastated about it, or they thought they were getting a promotion and they didn't get that promotion. So even though it is not as significant as a loss of a loved one, but to that man, it was extremely significant, especially if they're the provider and, you know, they're trying to make moves and do these things and they feel like they've missed an opportunity. So when we talk about grief and loss, people will easily talk to you about it if it's a loved one. But what about a loss if you lost your home? And it doesn't even have to be the foreclosure. It could be just a fire. It could be anything. You
Right.
know, it could be, anything that you go through the process of losing can cause you that heaviness it may be hard to bear. And, some of us have post traumatic stress disorder. Some of us deal with anxiety. Some of us deal with depression. Some of us deal with suicidal ideations. Some of us mask all of this with our alcohol and our substance use.
That's right.
So we may be asking for help, but we're not asking it in a way that is really socially understood. Oh yeah, he the life of the party. He the one we want to hang with, not knowing that he's going home and really struggling.
Right.
And I think about Robin Williams all the time when we talk about mental health. This is one of the funniest men in the world, and to find out how much he just struggled with depression after
Right.
he made so many other people happy and laugh. It was heartbreaking.
Yeah.
And
Yeah.
so how many of our men are really suffering in silence because can they go to their mothers to say, hey, Ma, this is how I'm feeling? What about our young kings when they're dealing with things, when they had their first heartbreak? Man, dude, it's a bunch of more fish in the sea. Keep it moving.
Right.
No,
Right.
like them first loves, second loves, we got to teach our young ones to deal with their emotions and deal with it in an honest way and not just brush it under the carpet.
Yeah.
So that we can
Yeah.
raise a generation of men who know how to be emotionally intelligent and emotionally accountable. But it definitely takes vulnerability. It takes trust. Men are not just going to open up to anyone. Going to see a therapist is not a cuss word. It is not saying that something's wrong with you. Sometimes it's nice just to have somebody to talk to that is not going to see you in the grocery store or not live in the
Right.
house with you.
Yeah.
Like sometimes it's nice just to have a confidential person over there that you can talk to. If you had a legal issue, you're going to go talk to an attorney and
Right.
they're going to have client attorney privilege. Same thing with your therapist. So
Yeah.
it's important to have those conversations. And if they give you medication, take that medication. Just like if you had diabetes or you got heart disease, you're going to take those pills. If they prescribe you something for depression or anxiety, whatever, take your medications and don't
Yeah.
just abruptly stop them.
Yep.
Talk with your provider
Yeah.
first.
It's
Yeah.
never too late. It's never too late.
It's not.
Mm-mm.
Yeah, I definitely think one of the struggles for men in that space is when they have certain feelings or emotions, but there's nothing tangible to attach to why they're having those feelings and emotions, and trying to explain to people that you're feeling a certain kind of way when the world wants you to be productive, whether it's work, family. The world sort of tells men your duty is to produce something, is to provide something. And if you are struggling with doing that emotionally or mentally, and there's nothing tangible that someone else can see as to why you may be struggling with those emotions and mental issues, I think sometimes men may question, like, man, I really don't want to say nothing about this because I don't really have anything physically happening around me to explain to these people why I'm feeling the way I'm feeling.
Yeah.
Yeah. And it
Especially-
almost dehumanizes you, which I think that you get from a therapist, where you get treated like a human being and not just, I'm not saying that obviously men are human beings, but it's just and we do it to ourselves. Like, it's not even just the world doing it. Men, we tend to dehumanize ourselves. We don't give ourselves grace and space to feel and process emotions, where we think we're just supposed to take things that happen and then boom, beat on to the next thing, and not just take a pause, check in and say, man, you know what? That really made me feel like this, and just process it. You know what I'm saying? Yeah.
And outside looking in, people would be like, oh my gosh, Dub, Trey, y'all have this going on. You have that going on. Your life
Right.
looks amazing.
Exactly.
And it's just like, but you may not know the struggles that it takes day in, day out to
Right.
maintain all of these things that I have to do.
Yep.
If I'm being pulled in 20 different directions and I'm being asked so much of myself that I don't even have time to stop and breathe for myself. And
Mm-hmm.
so, that's where self-care comes into play. The ladies are going to go and get their facials and their massages, and they're going to take a mental health day and all of those things. But for our men, if they're an hourly employee, if they're concerned about, their evals at work, if they have a tough supervisor, can I take off? Is it going to be seen that I'm slacking? And, all of those things. And it's just like, I think it's so important for us to, really embrace and create a narrative that works for us as individuals. And yes, we work hard, but how can I still maintain my mental health and my emotional strength if I am not addressing the things that are brewing under the surface?
Right.
And because what you don't want to have happen is you have a breakdown, and then you're not going to be able to work. You're not going to be functional at home. And everybody's going to be like, man, what happened? How did we get here? And it's because it was just continuing to brew under the surface, and then the volcano erupts. So
yeah, we don't want that.
No.
We do not want that. So when you have that annual birthday physical, they should be asking you not just about your physical health. They should be asking you about your sleep patterns. They should be asking you about your emotional well-being. And just that's the time where we want you to be naked and unashamed. And we want you to be transparent with your healthcare professional. Be bold, speak up. Yeah, I really would like someone to talk to from time to time. Mm-hmm. Yes, I'm really struggling with anxiety. I'm very overwhelmed because of X, Y, and Z. So we can only get you the help that you need if you acknowledge that you need the help.
And you deserve the help, fellas.
Yes.
You deserve it. Do not talk yourself out of thinking that because you don't make a certain amount of money, or because you have bills to the ceiling, or because you didn't get promoted, or whatever negative voice you have in your head that's telling you that you don't deserve this treatment and to be treated this way, you are incorrect. You deserve to see someone to be vulnerable with, to tell your truth, and to get the assistance you need. You deserve it.
Yes.
Don't deny yourself that.
Well said. And stop talking to your crazy boys that don't know what they talking about.
How about that?
They're killing you.
Yeah. Stop talking to your friends and stop using Dr. Google. Using Google and YouTube and WebMD, because it all results to cancer. No matter what you Google about your health condition,
got you going to the gas station, getting prescriptions from the gas station.
You know what I'm saying?
Please don't. Oh no, it's just like when we went high school. You asking information from your high school buddies. Y'all all in the same boat. Nobody knows anything.
Right.
Do not talk to your boys. They don't know what they're talking about.
Ibuprofen don't fix everything. You know what I'm saying? You can't. I take ibuprofen and Advil for everything, fellas. It don't fix everything.
And neither does Robitussin.
Neither does Robitussin.
Yeah, man. And you know what? I was also thinking about when we was talking about self treatments, like drinking or smoking, or kind of things that men and people do in general to sort of, I guess, self treat, or the term I'm trying to use. I would say also, fellas, like going to the gym all the time to help you cope with your mental issues is also a coping mechanism. Mm-hmm. Yes, it's not drinking. Yes, it's not smoking cigarettes. It's not smoking marijuana. It's not doing drugs, but it is something you're using to help cope with a condition that you need to go see someone about.
Yeah, because I don't think they're quite ready for mixed martial arts, because they're not quite ready for that. But definitely have those conversations and build a relationship with your healthcare professional. You may only see them once a year, but just know that person is there to be non-judgmental, to really make sure that they're in alignment with what your goals are. Your goals should be centered around supporting yourself, supporting your family, doing the wonderful things that you want to do in life. And so the only way that you can do those things is to make sure that your physical body, your mental body is all in alignment and healthy and ready to move forward. And if there are challenges, that you have a plan in place to address what those challenges are. So you're going to plan a trip, you're going to plan activities and all of those things. Plan to take care of yourself.
Absolutely.
How often do you see health conditions that stem from like not taking care of your oral health?
Yeah.
So we believe, at least I know I believe, that, I understand gum disease and, things that are happening in your mouth because you don't take care of your oral health. But what type of things do you see that come from not taking care of your oral health that have nothing to do with what's in your mouth?
Sure. So,
Dr. Mo, before you speak,
yes.
fellas, for those who don't floss and don't brush their teeth, pay attention right now. Okay.
Don't forget the mouthwash, Trey.
Ding.
All right. So, first of all, you want to make sure that you have a really good toothbrush, that you're not using the same toothbrush for the whole year. You should be changing that thing out every 3 months, right? At the very least. Like come on, fellas, get them get the electric brush and they got the little attachments, just pop a new one in, keep it moving, okay? Why are you shaking your head? No. Yeah.
They're not doing it because they're not doing it.
They're not doing
You
it.
should not have a toothbrush.
The color on that
look like
toothbrush used to be blue. That joint is white now.
Exactly.
5 years old.
They done tore that toothbrush down.
Some people toothbrushes look like they've been brushing their shoes with them. They all frayed and whatnot. Please get you when you buy the pack of toothbrushes from the Costco or Amazon or wherever you're getting them from. You can get a 5-pack, you can get an 8-pack, whatever you need. Have your toothbrushes, okay? If you got an electric one, that's always nice too. They have all kind of oral health gadgets now, but you definitely want to floss. If you are having trouble with just the regular floss, they have the flosses on the sticks. You want to take good care of not just brushing your teeth, but you want to address your gums and then have a good mouthwash as well. And you want to make sure that you're staying hydrated because some people experience dry mouth. So that can cause some challenges as well. So there's a lot of bacteria that lives on our skin. There's a lot of bacteria in our mouth. So you want to make sure that you're taking good care of your oral care. You should be going to see the dentist at least every 6 months, not just twice a year, saying, oh, I'm going 8 months and then 4 months. No, every 6 months, make it a cyclical process. Schedule one of them around that birthday and then another one, 6 months later. So that's a good way to keep yourself reminded, keep yourself on schedule. But yes, you can have significant heart disease problems because of your oral health. You can have intestinal problems because of your oral health. Again, the bacteria can lead to infection, and that can cause problems within your heart, your lungs, and your gastrointestinal tract. So take good care of that oral health. Because I know somebody want to kiss you. You want to be kissable.
Not with that funky breath.
Nasty.
Disgusting. You're nasty.
Yeah,
ladies, ask your man when the last time he flossed. I know so many brothers that don't floss. It's crazy, bro.
Yeah, you gotta floss. And putting those and putting those white strips on your teeth to make your teeth whiter, that can't replace cleaning your gums. Like those things don't make your gums clean. They just whiten the teeth. So,
well, and also know that the whiteners can damage your enamel on your teeth and make your teeth brittle. So just be careful. So talk with your dentist before you start just using them little strips and things like that. And if you notice, if you've ever used them before, your teeth will become sensitive to hot and cold. It's because it's taking layers of the enamel off of your teeth.
Right.
So you want to pay attention to your oral hygiene. Make sure if you got a cavity, if you have a need for a root canal, whatever it is, if something's happening between those 6-month checkups, go get it checked out because it's nothing worse than having a tooth infection or gum infection and all of those things. Because if you have an infection anywhere, you're going to need antibiotics. And then the antibiotics brings its own set of problems with your gastrointestinal tract. So be mindful about taking good care of your oral care.
Yeah.
Clean your ears too. The backs of the ears and the inner. Don't use Q-tips. No Q-tips. No Q-tips.
Nasty.
No Q-tips.
Yeah, I stopped using
your wax further in.
Yeah, that's right. I stopped using Q-tips. I don't know, a long time, probably about 6-7 years ago. I was that's what I use habitual every day Q-tip. And and then a doctor told me like, nah, you need to stop doing that. That just pushes the wax further into your ear canal, and it doesn't. Yeah, stop doing that.
They're great if your ear is itching and you need something to scratch it a little bit, but
Yeah.
Don't even buy the Q-tips. They not even needed.
Yeah, at the time when I was doing it, I was actually doing it to get the water out of my ear.
Mm.
So I wasn't even going deep into my ear. I was just trying to get the water. And my doctor said, stop. Just don't do it.
Yeah. And you don't need any powders. Get you, the whole powder situation and that in your airway and all that good stuff. You want to smell good. Take a shower, use some good soaps, use your colognes and all of that. And, they got all over body deodorant now. So you don't need the Johnson & Johnson baby powder like we used to use and getting it all in your airway. Take good care of your insides.
That's your mama doing when you was young. Threw that powder on you.
And the Vaseline all over your face.
All on your face.
They did the best they could with the information they had. So I think on their shoulders we stand. But get informed and get some new information. Talk to your healthcare professional.
Yeah. Another question for you. For the people, the fellas that don't go to the doctor on a regular basis, what are some signs that they may be having blood pressure issues?
Okay.
Because obviously if they're not getting checked, and they're not getting that monitored, they won't know that they're in a concerning level with their blood pressure. So are there any telltale signs, other than this going to see the doctor just anyway? But for the listeners who haven't been seeing one, are there telltale signs that they may be having some issues with their blood pressure?
Yes. So first things first, I do want to, I hope that no one feels shamed as we're talking about here. Go to your doctor.
Yeah.
We know this is a learning curve. This was something brand new for you to hear from many, many people. And maybe this is something that you already know. So we're not judging you. If you haven't gone, we want to encourage you and just let you know, hey, call us up. If you want us to go with you, we'll go. Tom Joyner had a whole take your loved one to doctor day and all of that kind of stuff. We want to keep that type of positivity going.
I go with you, fella. I go with you fellas. I roll with you. I pick you up and take you.
Yeah, that's what's up. But yes, there are some telltale signs. If your blood pressure could be high, you might have some headaches. You might feel dizzy. You might have some blurred vision. You might have swelling in your feet or your hands. And so some of those may be a little later signs. Your heartbeat may be going pretty fast. You may be short of breath. So it could be a couple of things. So if you're not feeling your normal self, and you should know yourself well, you should know if you've been able to sleep or if you've been able to walk up a couple flight of stairs and now you haven't been able to. If you've gained a significant amount of weight in a short period of time, that'd be a good conversation to have. And so some of these things may not necessarily be linked just to your heart. It could be something that's going on with your kidneys because you may not be getting the fluid out of your body the way it needs to be. So just any time that you've noticed a shift in how you've been feeling, some people also start to sweat like really badly, just out of the blue. And so for our women, we know we might be in perimenopause or menopause, but for our fellas, that's not necessarily the case. But we definitely want you, if you've noticed, we don't want you to pass out and faint and all of those things. Those are more later signs that something's going on with your blood pressure. So pay attention to those subtle signs. Is your heartbeat racing? Do you feel dizzy? Do you feel lightheaded? Do you have some headaches that are going off and on? Have you had some blurred vision? Any swelling in your hands or feet?
Okay. Yeah. Appreciate that. Great information.
Yeah.
Absolutely.
And stay away from the commercials with the low T. Talk to your doctor before you take any type of supplements.
Don't be listening to Doug Flutie and whatever. Yeah,
it may work. I don't know, but talk to your doctor, please.
She'll like it too.
Please.
Right, she'll like it too.
Frank Thomas.
That's right.
Man, they show that commercial 30 times a day.
Get my pimp back, and she'll like it too.
She'll like it too.
Hey, that's funny.
Yeah, have those conversations with your provider because that could actually be an issue with your heart or your kidneys if you're unable to perform. So have a conversation. Don't be embarrassed. You
That's
could
right.
be stressed. It could be related to your mental health. It could be related to your physical health with your blood flow. So again, your blood pressure and your kidneys and all of those things. So you may not
Right.
need Viagra and Cialis. You may
Yeah.
just need to take care of your blood pressure.
Yeah.
So
Fellas,
have
we're
that.
talking about erectile dysfunction if you haven't picked up on that yet.
We
ED, baby.
we would formally introduce it for the fellas, but I know your listeners are like, I'm good. I got that on lock. I went to the gas station.
Brothers
We
know
got those pills.
them gas station hoppers. They know.
Right.
But yeah, please have the conversation with your provider, and that's a very sensitive topic for men. I can only
It
imagine.
is. It is.
Because that's you want your lady to be happy, so or your partner. I don't want to specify that you want your partner to be happy, and so it is not an attack on your manhood. It could really be an underlying medical issue that's going on. So please openly talk to your partner about that, and have them go to the doctor with you, and openly have that conversation with your healthcare professional, because you might not need treatment for erectile dysfunction. You may have an underlying medical condition that, if that's fixed, whether it's diabetes, heart disease, kidney problems, if those things are addressed, then your performance may be right back to where it once was. Yeah.
Love it. This is not a medical thing. But what I want to say is, for the people who are partners, whatever it is, and your partner is a person who is not going to see the doctor on a regular basis, just understand that everything that they're not doing to take care of themselves can eventually be your responsibility to take care of them, depending on what their issue may be later on. So if not, if you can't love that person enough to force them to go to the doctor, do it from a selfish perspective, understanding that if they aren't going to the doctors and know their statuses, to know what's going on, that it's going to fall on you to have to step in at possibly in some point in you all's relationship, long term, depending on what ailment or issue that partner may have later on from not getting these checks and knowing their statuses on things.
Absolutely. Because, when you're going for your chemo treatments or radiation, or if you have to have surgery and things like that, you're not going to be allowed to drive. You're going to need somebody to be your support person to take you back and forth to these appointments and to receive the care that you need. So it is not a singular focus or individual activity. So being intentional about your health is that much important. So and you don't want to be like, oh, I don't want my kids to put me in a home. Okay, take care of yourself.
Take care of yourself, and they won't have to, right?
Take care of yourself. I mean, we all gonna age. Hopefully, we all age gracefully, and all of those things. And we can get long-term care insurance, and all of those things to help our children out. But I wanna be spry. My grandma just met 84 last Friday, and we had a great time. She's not on any medication. She healthy. She had a little Hennessy and she had a little juice, and I was like, "Let's do it, Grandma." And that, that's the genetics I want to pass on to my kids. So
Well, you touched on it, Dub. You definitely want to have your loved one be diligent about getting checked out. But on the other side of it, that loved one needs to also be comfortable with sharing that information with that person, and not just the person that you're with, but your children also. How many times have we seen parents not tell their children, their adult children especially, what's going on with them, medically, or, and then you find out when it's too late, when it's, 2 weeks left for this person to live, or whatever the situation may be. Parents, be very active with letting your children know what's going on with you. Believe it or not, they may have a tough time dealing with it initially, but that information could motivate you, and having those conversations could motivate you to want to fight whatever it is you're fighting with this health thing. So, definitely, fellas, don't be afraid to let your children, your young adults know, especially what's going on with you, because I think that would give you another set of eyes and ears where somebody can say, "Hey, Dad, did you go and get your prostate check?" Guess what? You're gonna go get your prostate check because
Right.
your 20-year-old son is asking about it
Mhm.
because he knows that you're high risk.
Right.
You know, so just think about that, fellas.
Yep. Yep. And just know that, you have another layer of accountability.
That's right.
So, if we change that narrative in our families and we're checking in with one another, we all want our families to be here. We want to do the family reunions. We don't want to do the family funerals. So
That's right.
That's right.
let's hold everybody accountable to these things, but do it in love. It's like nobody's chastising you. Nobody's trying to shame you. We're not trying to be in your pockets and telling you what you need to spend and you need to have this insurance or that insurance, whatever.
Right.
We want to celebrate. We want to enjoy life, and live it to the full. And the best way that we can do that is to be healthy.
That's right. Everybody's talking about making money, but you got to be around to spend it.
Who you telling? I've never seen a Brinks truck behind a hearse. Not never, ever, never.
Health is wealth.
Health is wealth. And y'all look so good on the outside. Make that inside look good.
Yeah.
So I'm appreciative that you all have addressed men's health. It's not an easy topic to dive deep into. It's a lot of stigma, a lot of things that are kind of left hush hush. But you all are bold. You all take on some bold topics just in general. And with it being Men's Health Month, I'm excited about, just trying to change at least one person's perspective, one person's life, and knowing that they will change their whole family's life moving forward. So, just excited about, people living life. People say life is life and like it's a negative thing. No, life is life and it can be really good. I want to be on the beach and looking nice and feeling nice and running in the sand. We don't want to be worried about getting ready to do a Fred Sanford and holding our hearts and all of that kind of stuff. So take good care of yourselves, fellas. We need you. And all of our kids need you. Our communities need you. We need you at your best.
Step out of that box, guys. Have the conversations. Take care of yourself.
Phone a friend. Phone a friend if you need one.
That's right. Hey, listen, if you want to hit us up, you send us an email, inquiry, INQUIRY @dubandtrade.com. You can email us. We even got a phone number somewhere. Email us.
Yeah.
With your questions or concerns. We not doctors, but we can send you some web links or something.
Absolutely. Absolutely. And I do companion care. I go to visits with people for their appointments because they like, I don't know what they talking about. You a nurse. Come on in here and tell me. No problem.
Yeah.
So I want my community to thrive.
Yeah, we do too. And that was one of the reasons we started this podcast, is provide information to our community. Mm-hmm. And like I said, if you guys have any questions about any topics that we touched on today, obviously we have a inside track to Dr. Mo here. So if you have a question, obviously, like the disclaimer we said, we're not your doctor. None of us are trying to take the place for you seeing a primary care physician or none of those things. But if it's some general information that we can provide you, send us an email. We don't mind at all sending you some web links or some reading material or anything like that to help you educate yourself on whatever it is you want more information on.
We out.
Okay. Thank you.